And if you want a copy, you're more than welcome. We'll send you one. Okay.
Great. Thank you so much.
Okay.
Well, I think we're ready to go now. Thank you so much for inviting me. My passion at this moment is to deal with the state of our colleagues, physician burnout, and also what I believe are the advantages of osteopathic training in terms of maybe having a better answer for how we get to where we want to be. So now, if we can just get the slides to move forward. Let's see. Give me just a moment.
Deborah Munoz on the line. If she wants nystatin because she did a test and her candida is in her belly. Okay. What's the dosing on that?
So we're going to, what I'm going to do for this next hour or so is give you a taste of what I've compiled as a 15-hour CME series, starting on the 26th of February and running for 3 consecutive Saturdays. And the first step is for us to actually understand the problem, or I would prefer to say the phenomenon, and to identify, I think it's a good metaphor to think about burnout a little bit like how we treat hypertension. We talk about it as being a silent disease. So I think there is a strong element of denial in terms of looking at burnout. So we're going to take a look at that. Also, in this contemporary era, I feel we need to provide kind of an integrative approach. So it's not going to be just sort of a lecture of knowledge and facts and surveys, although I certainly have researched it enough so that I feel like I can speak from some authority. But also I want to mix it up with a little bit of awareness and presence and self-reflection. So I want to start with a quote of Albert Einstein. He says, "Learning is the beginning of wealth. Searching and learning is where the miracle process all begins." The great breakthrough in your life comes when you realize that you can learn anything you need to learn to accomplish any goal that you set for yourself. This means there are no limits on what you can be, have, or do. So the World Health Organization has come up with a definition for burnout, but the original definition was developed by Herbert Freudenberger in 1974. He wrote several articles that are still available on a Google search. And he defined burnout as a combination of exhaustion, cynicism, and perceived inefficiency resulting from long-term stress. The World Health Organization has come up with an official definition as a syndrome conceptualized as resulting from chronic workplace stress that has not been successfully managed. We might, reflect on what kind of message that gives someone. It is characterized by 3 dimensions: a feeling of energy depletion or exhaustion, increased mental distancing from the job, which is dubbed depersonalization, and feelings of negativism or cynicism related to one's job and resulting in professional inefficiency. Sorry about that. One little typo correction there. I'll make a note. So one of the things that Einstein said is that we can't solve our problems with the same level of thinking that we used when we created them. So we might have to think a little bit out of the box in terms of dealing with burnout. But let's look at some statistics. Pre-COVID, the Mayo Clinic did a study that showed that more than 50% of practicing physicians were experiencing symptoms of burnout. The AMA did a review survey released in autumn of 2019, which was data pre-COVID, and was pleased to report that the overall burnout rate among physicians had dropped to 42%. One of the articles suggested that in one hospital, the recreation of a physician's lounge was one of the main things contributing to the reduction in the complaints of burnout. I don't know how many of you were practicing medicine, back in the 80s or 90s and can remember nurses standing when you came to the nursing station, or catered lunches with white tablecloths. I know it's gone away, and I'm not saying that there should be some kind of entitlement, just that there was some positive feedback and support, and some TLC that doctors got at one time. And then in the fall of 2020, the AMA released, based on early data from dealing with COVID, that the rate had remained at 42%, but that it was particularly affecting people on the front line. Critical care was 51%, ID was 49%, as you can read here. And primary care, family docs were 47%. Now, the AOA on its website states that the majority of osteopaths are in primary care. So we should keep this in mind in terms of relevance. And it suggests that more than half of all practicing physicians are experiencing some burnout symptoms. And another thing I think we should keep in mind is that currently 1 in 4 medical students are in osteopathic medical schools. So we are having more of an impact, and perhaps we can find more support from our tradition in terms of how to manage our training and our work life. And again, the data showed that primary care was more than 56% of osteopaths. So the latest data came out from Medscape just January 27th, comparing 2022 to 2021. And the numbers have shown an increase of 7% in terms of people saying burnout has had a strong or severe impact on their life. And if we look more carefully at this report, it shows that, and it makes perfect sense given how hospital care is happening with the COVID and the limitations in terms of family members coming with patients into the emergency room. The greatest growth of burnout has been in emergency medicine, but family medicine is still having more than 51% reporting burnout. Now, when burnout was first identified, there was an implicit bias, which I hinted at a few slides back, that if someone was having burnout, it was a problem of the individual, that somehow the physicians who were experiencing symptoms were somehow lacking resilience or flawed, and that these kind of character traits were supposed to have been instilled in our residency training. I can remember at one point talking to a surgical resident when I was doing my family practice residency. And he was like, it's so frustrating just being on call every 3rd or 4th night. There's so many cases that I'm not involved in. This was the classic example of the Superman resident. I just want to point out that in the 20th century and 21st century, there still is this cultural imprint that physicians are encouraged to be superhuman, putting the patient's needs ahead of their own and their own families, and that it's engraved in us with delayed gratification, with the promise of well-compensated income in the future. And as we talk about disenfranchisement and dropping of expectations contributing to burnout, we all are aware of the flat curve in terms of physician reimbursement. So going back to this idea that was implied back in the 80s that there was some character defect, which I think still carries through with people being reluctant to want to talk about burnout. They asked in the survey for 2022, does your personality type contribute to burnout? 34% said they thought it did, 43% said no, and 23% were unsure. Medscape went on to say in their article, in our conversations with hundreds of physicians, they said repeatedly that constraints in the system which prevents their patients from getting the care that they need, this moral injury was the primary source of physicians' distress, and that it's time to stop holding individual clinicians responsible for the dysfunctions inherent in the US current healthcare system. So looking at the last 18 months or so, physician burnout is much more widely recognized than in the past, but there is a lack of consensus in terms of how to address the problem. One avenue is to look at institutional changes and getting feedback from physicians. And there has been a focus on looking at the structural components of modern healthcare. And with the transition into electronic medical records, all studies have confirmed that there has been an increased workload involved with medical documentation, medication reconciliation, and with many physicians being given a large email correspondence list as part of their panel as well. So statistically, during the surveys, they find that besides working a full day at work, after dinner, doctors are going back online to complete their notes and to follow up on emails from patients who can't get in to see them, but want to hear from their doctor. Now, the curious thing in 2021 is that when Medscape started to look at physician burnout, they added suicide concern as part of their intake. So that suggests that the problem might be getting a little more serious. But again, in 2021, the biggest complaint was too many bureaucratic tasks. In 2022, they now title the study Physician Burnout and Depression. And while the bureaucratic tasks came down a couple percentage from the previous slide, lack of respect from administrators, employers, and colleagues went up. From a healthcare institution perspective, burnout is undesirable because there's lower patient satisfaction scores and differences in the quality assessments. There's an increased risk of medication errors when one's tired and distracted. and risk of malpractice claims against the institutions. There's also a higher turnover of staff and physicians and more going out on disability. One article said that the long-term effects of one doctor leaving early had $1 million impact on a large healthcare institution. We also have the more common coping skills for being in denial about burnout, as in excessive alcohol use or drug abuse and other addictions, and the increase in physician suicides. This slide has a lot on it, but basically what the conclusion is that it is the confluence of the following factors. There's the macro economy of healthcare, which is based largely on volume of patients seen and limits how much time you can spend with the patient. There's the changes that have happened with EHRs, and although there is some lightening up in terms of the CPT code requirements to justify certain levels of encounters with patients, there's been a push for a decade to include more is better in terms of including in your note. And then there's just the reality of balancing a career of healthcare with other life desires, like having a family and having a personal life. And so all of these pieces need to be considered. Now, from an osteopathic perspective, and I know some doctors might consider this fighting words, but I've always believed that osteopathy has offered more rather than less than the allopathic model. But if we look at the reality, the majority of current osteopathic physicians are not guided by osteopathic principles in their daily practice, primarily because during the largest learning curve of their career, they are in allopathic institutions and often are told that I'm not qualified to supervise you doing any osteopathic manipulation, so don't do it. But also in terms of more of a philosophical perspective from osteopathy, because I really believe no matter what your specialty, there is an osteopathic philosophy that you can bring through in your interfacing with your patients. We have forgotten the triune nature that A.T. Stills emphasized, that we are body, mind, and spirit, and every human is triune in nature. And I would assume that speaking with a group interested in integrative medicine, that we are interested in more than just lab tests. But I have to say that when I was going through medical school and my residency and starting my practice, there wasn't a pathway to become certified as a integrative physician. So I have studied a lot besides osteopathic manipulation. I've been a classical homeopath for over 30 years and a yoga practitioner. But the core code that A.T. Stills beckoned osteopaths to do is to find the health in the patient. And in my own practice, I've endeavored to provide care to patients that support and enhance the body's inherent tendency to strive towards health and homeostasis. And from an osteopathic philosophical perspective, I invite you just to consider making an intention, a conscious intention, as you step in to seeing a patient, that you want to promote health in that interaction, and just observe how that might change the flow. I think I mentioned briefly how Einstein says we can't solve a problem by working on the same level. So I have a quote from a homeopathic mentor of mine. We have to raise our understanding up a notch or two in order to meet such large collective diseases. Because I think we should consider burnout as a collective disease. We can get a lot of insight into the connection between the epidemic, the political situation, the geographic situations, cultural, scientific, warfare. I haven't checked the latest news from Eastern Europe, astrological, financial, whatever is happening at this time. It's all part of a bigger collective state. So what can we do in terms of promoting physician health? Before we go too much further, I'd just like to suggest these possibilities. Making a higher priority of finding balance in our work-life paradigm. That can mean committing to leaving work at a certain time. Promoting healthy and supportive working environments, which is like interacting with our staff and colleagues. Making space and time for physician self-care. We'll go into this in depth during the 3 seminar parts that I'll be offering. Treating our colleagues with osteopathic manipulative treatment and receiving holistic osteopathic care for ourselves. And reconnecting with spirit and including it in our personal and professional vision of serving as a physician. And in doing so, finding meaning and purpose and experiencing vitality and connecting to deeper states of meaningfulness. So what are some warning signs that we might be having burnout? Feeling tired all the time and lacking energy. Having trouble falling asleep or waking up several times at night. Experiencing forgetfulness or struggling to concentrate. Some people might try to just toss it off as just getting older. Becoming pessimistic and or feeling hopeless. Having feelings of becoming incompetent or having poor achievement with where you are in your career and having lower motivation. And perhaps more concerning is feeling isolated. So now this brings us to what I think is one of the issues, which is denial. Often physician burnout symptoms are more apparent to others that we see rather than to acknowledge within ourselves. And the blocking of performing a self-care inventory adds to the underlying stress, leading to further expressions of burnout, and we don't want to take a look at it. So curiously, in 2020, the AMA decided, since physicians were not responding as well as they hoped on an administrative level to the rising percentage of burnout, they decided to reach out to the spouses Is someone in your physician family suffering the symptoms of burnout? Physicians can fill this out, or a family member can answer it for them. It's not uncommon that a busy physician might not have time to get around and fill out the form. So please fill it out for us regarding your partner. And so they ask these questions, and the score could be from 12 points because it had 12 questions, all the way up to 48 points. I'm not going to share that particular details at this time. I just thought it was a good move to try to explore how real this problem was. I would like to see if I can get this. Oh, let's go back one. I would like to share a different screen now. I might need some assistance, guys. Let's see. Give me just a moment. Bill, are there any questions at this point that I can't see?
I don't have any in the chat. If anybody has any questions, please, address them.
Well,
Yes.
I have one because it's on the screen anyway. What's the big lie?
So I was trying to open up the little scene from the Truman Show. Do you remember that movie?
Yeah.
Okay, I decided it's so I'm having to scroll down and because I can't highlight that. Yeah.
We don't have good success with the showing videos on the Zoom thing.
All right. So in the scene, Truman is sailing a little boat on a pond, and the sun is shining and everything. He's got a big smile on his face, feeling really good. And the bow of the boat suddenly hits a wall and ruptures the wall. And he suddenly realizes he's been living in a television reality created for him. And he finds, if he walks along that wall, he finds a stairway that blends into the painting of the wall so you don't see it, and comes to a door, and he is being watched by millions on the television. But he decides to walk out that door, and it not only has he got this big awakening, but all the people watching him are also given the chance to ask the question of whose life are they living. I'll keep that in mind about trying to figure out how to get that link available. So a psychologist, Karen Meager, wrote in 2020 that when people are going into burnout, so it's not specific to just physicians by any means, that they enter a phase of denial, making statements to themselves like, it'll pass, I just need to push through this phase, get this done, or I just need to keep my head down and get to the next holiday and things will be fine. Or, God damn it, there's nothing wrong. Or people will judge me and think badly of me if I show that I can't cope. And so we try to be the best version of what we want to be. But we may be able to see the warning signs, if nothing else. If the following happens, you no longer return from a weekend or holiday feeling refreshed. You feel compelled to work a lot, even if the things you're working on don't seem critical or urgent. You realize there are elements of your work that you used to enjoy, but they're no longer fulfilling. You're generally more grumpy or snappy with loved ones and close work colleagues. And you don't have a sense of achievement, even if you logically know you're achieving or making great progress.
Well, this is a sign of depression.
Yes.
I think he needs medication. The SSI will work.
That is one solution.
Right,
But
because this is more depression and suicide. Is there suicide attempt there or no? Planning of suicide or?
No, that's not in the early phase. Yeah.
Okay.
Yeah. So when this original concept of burnout was labeled, defined, it was actually seen in the context of a spectrum. Let me just move on to that. Engaged to the left, becoming ineffective, feeling overextended, becoming disengaged, and frank burnout. This was the spectrum that they were placing it in. The initial definition I mentioned earlier, but I can say personally for myself that cynicism is not a way that I cope with things. So when I read this initially, I would say, well, I'm not at risk for burnout. In the larger course that I'm offering, we will look at how the definition has evolved since '74 and how I think it reflects more accurately the phenomenon. But Christina Maslow and her colleagues developed the MBI in 1981. And it has 3 components looking at these 3 categories, which have been a little bit revised. So emotional exhaustion, depersonalization, and diminishment of a sense of personal achievement. And now I really want to, this is my moment not to forget that if you're interested in participating in my workshop, you can email me. And this website will take you to a further description and the registration page. Maybe for time, I'll move a little bit past this particular slide. Well, what do we mean by emotional exhaustion? It's becoming increasingly more tired and unable to bounce back. By depersonalization, it's pulling back, disconnecting in your relations at work because of feeling drained or annoyed or frustrated, becoming more distant, language and behavior reflecting a state of disconnectedness. And what I think is important to mention at this point is that what's more troubling is that this is associated with not being in touch with yourself. It's not that it's only externally impacted. It's coming from less of a sense of who you are and having less empathy for yourself and others, as demonstrated by the fact that you're going to push through rather than maybe take some time for yourself. And the third point was this lack of personal achievement and doubts as to whether the role or setting that you're working in is right for you. So I was thinking that we could take a few moments. I actually timed it myself. It took like less than 5 minutes for us to take the MBI, and we can just see where we're at. Just a moment to switch screens. I think maybe I have it also. All right. I wasn't aware that these links were not going to work during the.
Yeah, unfortunately, that happens quite often.
Yeah, well, thank you.
Are you trying to play a video?
No.
Okay. Because if you're trying to play a video, you need to click a voice box when you do the share. Once you do share, there's a box on the left, you need to click it. Then you can come up with sound and video. If you don't do it, you will not have a sound.
Thank you. I try to make note of that for the next time, but this is just going to load up the questionnaire for us, okay? I just need to take a moment to make sure I'm. Let's look at that. Looks good. Ah.
Well, try again.
Ah, all right, dang. It worked last night. Let me, I'm going to stop sharing for just a moment. I do apologize.
Could we just say, any doctors out there having burnout, will you raise your hand? Because I think most are, right?
I'm gonna say, any doctors not having burnout, raise your hand.
Yeah, there you go.
I do use a lot of cynicism. So yeah, definitely showing signs of burnout.
Okay, David. Well, I think in the interest of time, I'm not going to try to figure out why that link that worked last night before bed is not working. But it's, I'll pull that slide up again. It has, I believe, 14 questions. And it's not that painful to take. But I will share while I'm trying to get back on that when I took it in the fall, my medical group had informed us in February of 2021 that it was going to go bankrupt and it was closing its doors on May 1st. There were 56 docs in the group and they were sort of just on their own to find a home. The cardiologists were welcomed immediately at the largest hospital. The irony was that the cardiologists, as the founders of the group, had guaranteed salary contracts. So during COVID, when they were unable to perform procedures, they were still getting their salaries. And the primary care docs who were still seeing patients were told there was no money to pay their salaries. I joined a smaller group out of that 56 that went live on May 1st. And I was joined as an employee physician and discovered by July of that year that I was told that there's no difference between you as a physician and a file clerk. So I don't know why you think that we should pay attention to your individual needs. So by October, I decided to leave the group and wanted till the end of the year to do the transition of recredentialing with all the insurance companies and going into private practice, incorporating, and succeeded in all of those steps. And now that it's mid-February, I'm actually starting to get paid again for my work. But I'm just sharing that, you know, when you look at the list of things that are stressful for people, buying a home, having a child, getting married, getting divorced, going bankrupt is one of those. All right. So now let's see if we can get back on.
Doctor, while you're in the process of getting back on there, I'm just going to chime in. I don't often. My name is Dr. Nick Palermo, and I was a program director for many years for a residency program with significant burnout from prior coordinators. And the question is, you've really mentioned, hit the high points, yet what do we need to do when we have burnout? Well, what I learned with the residents, which I did incorporate, was to become aware. And number two, in the awareness, what I realized that most of my residents were depressing, suppressing, or repressing their feelings and their needs, and they did not have connection. So one of the things that I did was that I went into weekly, if not monthly meetings, and as a group discussed how we all were having these feelings and what do we need to do with them. And so the other thing that was incorporated for a short period of time were doctor groups were getting together to know that we aren't alone in the process and how could we help each other, whether it was an EMR difference. But you hit the main things that happen to most physicians with regards to money, the financial things, home, sex, kids, spiritual needs that are being missed, let alone the nutritional and physical needs. So I'm just wondering what you suggest to help in burnout.
Well, I'm going to have some slides on that. Is that, can I continue or?
Yes, no, that was just
Okay.
a comment while you were
No.
trying to find your,
Yeah, oh, thank you. Well, I mean, that's why I'm devoting 15 hours to this as a workshop. Because we have not been really trained well to practice self-care. And many of us have shadows around that, which has served to get us where we are, but now we're burning out. So some of it is really committing to self-care and getting into taking time with yourself to figure out what would feed you. I really take my hat off to you in terms of what you discussed doing in your residency program. And I also went to family practice residency program in Santa Rosa, California, that was part of UCSF. And they had a balance training for the residents through all 3 years. So there was a venue for people to present challenging cases and to be like vulnerable in terms of what about it was affecting you, to grow in our own emotional maturity and understanding of ourselves and understanding of compassion for what our patients go through. So I commend you for what you did, but I think it's making a commitment to our triune nature. Are you able to see my screen
Don't
now?
you think like meetings every week like this one helps to relieve the stress of the doctors? What do you think?
I'm sorry, could you repeat that?
Don't you think meeting and seeing Dr. William Bill every day helps to release the doctor's stress? That's why they're here.
Mhm.
I'm not sure what you're getting at.
I'm getting really the weekly webinar that you're doing. It just helped the doctors to having
Oh.
that social life. Don't you see that socialization that we
Yes,
need?
absolutely.
And the think tank and sharing and talking about their problems. You know, it's like a club, right? And Dr. Bill, with his sense of humor and all of that, I mean, it's just it's a blessing.
I agree.
Yes, and should be acknowledged, absolutely. I see a hand raised.
Tell us what to do if we had burnout. Question.
Does Cheryl want to ask a question?
The question was
Larry,
what?
I raised my hand because I didn't think I have burnout right now, but I can't get the hand off.
Well, nice to acknowledge you.
This is Dr. Cruz. One of the things I also think is important to address besides the emotional and mental aspect is like you brought up the part where your practice went bankrupt and then to start over again. That's another thing is with all the interference with insurance companies and third-party payers and despite, charging what is supposed to be fair, we're not getting paid for the time and effort that we should. If you calculate the number of hours that we as physicians put into seeing our patients, reviewing labs, reviewing MRIs, all that, the person at Sheets actually gets paid more than we do.
Yep.
So I think that's another thing that really needs to be addressed, because I know the regular layperson thinks that physicians are rolling in money and don't know what to do with themselves. And, I'm sure everyone here has a more realistic view of that.
Yes. And it does raise a question, if we don't value ourselves enough, is that a reason why we've tolerated this, I used to say flattening of our reimbursement, but it's actually more of a shrinkage when you look at all the inflation over the last 30 years. And also why I think that there's room for doing some inner work in terms of shadows that we might have about feeling guilty about having abundance in our life. And abundance is not just money, but also having enough energy, having a vital life, having a loving life. And that's part of the self-care that we're going to address in the workshop.
I think the other thing as physicians is that, you know, it's not that we don't have the self-care, it's just that we go into medicine with the desire to help people. And that's always our focus, is helping people, is how can I help this person? You know, that's why we stay late at the office. That's why we do go outside our comfort zones to learn other things to help our patients, you know, despite what other people may say. I mean, that's why this group is here, because there's alternatives that help our patients and is not accepted in your standard, your regular programs. That's why as osteopaths also, we go outside what is normal, but we find effective for treatment with our patients. So it's not that, I don't think it's that we don't have the self-care. I think it's just that we are more focused on self-sacrifice, that everything else becomes secondary because we just have that call to help people. But that is what you say about realizing, you know, that there's a point where we have to say no and focus on ourselves.
The language that came true to me, and I think you might find resonance with it, is that I came from a place of overextending myself. In my residency years and the first couple of years in my private practice, it was the height of the AIDS epidemic in the US. So I was taking care of, dozens of young men, primarily, some women dying from AIDS, having a full-time practice, having a hospital practice, having a continuum program at the hospital to help with home health care for people when they got out of pneumocystis, but would be back, a few months later with CMV or something. This is similar to why I think burnout is worse during COVID, because we feel like, people are sick, they need our help, we have the skills. And so we come from a good place, but we're overextending ourselves. And if we put more time into healing and nurturing ourselves, we can come from a place of overflow rather than overextend. And to that end, this next slide, finding your way back to yourself. It's helpful to have like an accountability partner in terms of someone that you can share where you're at and make a commitment, that you're going to go walk in nature for an hour once a week, spend time getting to know yourself again. Stop comparing yourself to others. Stop judging yourself is the beginning. And then also starting to look at what are the lies that have prompted us to move through our life. Now, someone earlier asked me about the big lie, and there's several big lies, but in this case, what I mean by the big lie is that early on in your life, you were given feedback that you were too needy or too ugly or too fat or whatever, and that you needed to not be who you were at that point, but to become what others thought you should be. And we started to create compensations, which we can look at as skills and experience that we've gained that can be very helpful for us. But if you strip back to that original lie, as part of that process, we partitioned off parts of ourselves that are acting as shadows that can interfere with our success in having an abundant life. I'll be sharing more of this in the workshop. Getting back to other things that you can do that are more external, spending time in nature, practicing mindfulness, meditation, walking, yoga, any kind of movement, continuum work, Tai Chi, even preparing a meal if you're doing it from a place of mindfulness, and also paring down some of the addictive behaviors with binge watching so that you stay up too late and things like that. I'm hoping this is helpful. So what I'm encouraging is a shift in our perspective. Taking time to pause and reflect and change our reference point. So I mentioned briefly these core wounds that I talked about earlier. We can do inner work where we realize that every story that we tell of the biggest heartbreaks that we had or disappointments in our life, we can come to a place where rather than seeing them as like a wound that we carry around, is that they were an initiation that gives us an opportunity to reintegrate and to have a bigger heart and a bigger perspective. And another quote from Albert Einstein, in the middle of every difficulty lies an opportunity. In the workshop, I'm also going to propose that while there is richness in the osteopathic tradition that we can gain support by reviewing, we also need to move forward. The institutions tend to want to get a little fixed, and quantum physics has been around for more than 50 years now, and if we can tune more into our true nature, there's more possibilities for freedom. So Albert said, "We are just slowed down sound and light waves, a walking bundle of frequencies tuned into the cosmos. We are souls dressed up in sacred biochemical garments, and our bodies are the instruments through which our souls play their music." So my aspiration is for this to become a daily reality. Another quote from Albert Einstein: "The intuitive mind is a sacred gift, and the rational mind is a faithful servant. We've created a society that honors the servant and has forgotten the gift." So I think as part of self-care, it's an opportunity to reboot. And I thought I would just take a moment and invite all of us to do just a simple breathing exercise, practice together. So if you can just sit tall with your feet connected with the earth beneath you. As you exhale, we're going to allow our autonomic nervous system to relax, come into more balance, less sympathetic driven state. And as we inhale, we're going to allow ourselves to be replenished, refreshed, and recentered along our midline axis. On the exhale, you might be inclined to just make a little audible sigh. It helps the cells know we're serious about attuning our nervous system. Another big breath, allowing prana, life force, oxygen to go to the cells wherever it's most needed. And on the exhale, to release that which is no longer needed, any metabolic byproducts, any gases, any old thoughts or patterns to be free to dismiss. Let's just take 2 more breaths, perhaps in our own inner silence. All right. Perhaps we could open the mics, see if anyone has anything they'd like to share.
I have something to share. I think that all of people who desire in life is to serve others and have this giving spirit that just keeps giving and giving and giving, sometimes fail to recognize that their own cup needs to be refilled. And I really think that these Zooms do that for us. And that's why they're so important.
Thank you.
Well, great presentation. Dr. Bill, what's going on with Marsh? Everything is good for the conference?
Yeah, we talked a little bit about it. Well, first of all, Dr. Erskine, do you have more to go, or was that the?
This is a good place to pause. Yeah. Or
Okay.
stop. Yeah.
Okay. Well, I did discuss it a little bit earlier. So March 25th to 27th, we're on at the Flamingo Hotel in Las Vegas. We're also going to be online virtually. About 5 of our speakers so far are virtual speakers. Dr. Patel over here is one of them. I see you there, Dr. Patel. And Dr. Marsh is, our infertility specialist. She'll be virtual. Dr. Teitelbaum, who lives in Hawaii, will be virtual. And I think Thomas Levy also will be virtual. The rest will be live. We have Dr. Peter McCullough coming. He'll be coming now on Saturday. We had a change in plans today. So I'm going to have to adjust his time. He's going to speak for at least an hour, possibly 2. And then we're going to have a reception for him on Saturday night on the terrace at the Flamingo Hotel. Other than that, we have, our pretty all-star lineup. Kathleen O'Neill Smith, that's a name everybody here knows. Felice Gersh is another physician who's, prominent in A4M, AMMG. And then we have our state mandated requirements are all covered. We actually have two. Dr. Stock is going to be here also, and Dr. Cruz will be discussing medical ethics. Dr. Burgess and Joel Peterson will be doing our suicide prevention, and Dr. Leskovitz will be doing our pain management. So if you need, those of us in the Western states, if you need, I'm not sure about the rest of the country, if you need those credits, you will be able to get them at our conference. We have a really a packed lineup. We have great speakers, we really want you to. We would love to have you come in person. We understand if you can't. There is a discount, by the way, for virtual the online program versus being there in person, because we have to feed you, among other things. 24 CME credits, AMA and AOA, are available, and I'm actually looking to expand that because I have about 4 or 5 speakers that we're going to see if we can put them in either at lunchtime or at late, maybe in the evening. We have a number of vendors, we're hopeful to get a few more. I think I have about 6 or 7 so far lined up. If you know anybody who's interested in showing off their wares to our group, we're more than welcome to have them. Kent, I know we will get in touch with you as far as sponsoring a dinner. There's a number of things in the chat. Let's look at that. So Dr. Ortel said, my nephew wanted to be a patient when he grew up and he became a urologist. Okay. Any questions regarding the seminar, please email Dr. Erskine. He's got his email address right there, and I have it also if you need it. It was also on the flyer that we sent out this week for his talk, and I'll leave it on for the next couple of weeks, Dr. Erskine. So we'll give you, we have about 1,800 practitioners in our email list. So we'll be sending that out for you, if that's okay with you.
Yeah, excellent. I forgot to mention that there is an early bird discount that expires at midnight tonight. So if you're interested in saving $100, email me or go to my website before midnight, East Coast. I mean, wherever you are. Midnight.
Here is his website. You can, it's in the chat. From Dr. Nick, thank you, Dr. Erskine, for your insightful presentation and how important it is for us to become aware of our own needs and those of our colleagues and the methods that you recommend. For Dr. Cruz,
How many vendors do you have, Dr. Bill?
I think we have about 8 right now.
We need more, right?
We could always use more, sure.
So you have space for more?
Yep. Mm-hmm.
Okay.
Okay, you got some, let me know. Okay.
I have some.
You know where to get me.
Okay.
Dr. Cruz, can we have a talk on starting a cash only or concierge practice? Absolutely. We'll find someone for that. Joel Peterson's looking forward to your seminar. Dr. Featherstone, thanks, Dr. Erskine, for a much needed reminder on how to rediscover ourselves. And Dr. Elvino also thank you, Dr. Erskine. So you got a couple of, you got more than one Kinahara there. So
Thank you.
you don't know what that means. It means a pat on the back. So okay. Any final thoughts, Dr. Erskine?
I just thank you for this opportunity, and I hope to have an opportunity to interact with you again.
Okay, no, thank you. Please, if you don't mind, we would put you on our mailing list so you know what we're up to.
Yes. Yeah.
Okay, and one personal plug, my bioidentical hormone video course has been approved for 10 AMA, AOA, CME credits also. We're still working on the website and all of that, technical stuff. So if anybody's interested, just get in touch with me and we'll get you what you need, including a sample if necessary, if you want one. So, and with that, next week, Mike Beamer will be here speaking about the dermatological issues concerning COVID. So that's next week's speaker. We do have Dr. Teitelbaum in mid-March is going to speak to us before the conference on a Tuesday night. Anybody else, if anybody has any topics, Dr. Cruz will try to find somebody talking about transitioning to cash practice or concierge medicine. Not my specialty. Anybody else out there has any type of expertise?
I want to
on that?
present integrative oncology. So can you schedule me after Mike Beamer?
I can, sure.
Okay.
I have endless Tuesdays to schedule, folks. So.
Okay. So I can cover one of them.
At the rate this is going, like I said, I have endless Tuesdays. So anybody who's got something that they'd like to present, we're more than happy to accommodate you. If you think you want to try speaking at any conference, this is a great place to sort of get your feet wet. If you've not been a speaker before, it's we're all pretty laid back and relaxed, and you're just talking into a machine anyway. So we're just kind of looking at each other. So so again, Dr. Erskine, we've got many kudos here for you. Thank you for taking this time. Like I said, I will in our flyers that come out 3 times a week, we'll keep your information in there until your program commences. So I'm glad that we were able to have some interaction with you. And like I said, if you want this recording, I will certainly send it to you when it's ready. Usually it takes about 24 to 48 hours to get it put together. And any
That would be great. That would
any
be great.
questions, any comments, questions, complaints? And if not, we'll sign off for now. Next week, same time, same station. And thank you all again for coming. Please sign up for for in some way or another. Please support us for our conference. Obviously, the expenses are a little bit more than when we had them in Reno, and we have some high-powered speakers, and so there's some expenses tied up with them. So again, thank you, everybody. Thank you for your support. Please bring one colleague with you, so we can double our reach. And that would be terrific also. Okay, questions, comments, complaints? If not, Dr. Mike Beamer next week, same time, same station, 5 p.m. Pacific, 8 p.m. Eastern. And again, everybody, I thank you so much for your support. Over and out. Good night.
Good night. Thank you.